So, good afternoon, all of you. Now, we are going to next draping system, that is for a knee surgery. So, for knee arthroscopy or knee replacement or anything on the lower limb surgery, except the hip, what type of, even almost the same type of draping we are planning for the, upper arm also. But it won't be this much big, but it will be totally in a different way. But let us see how the knee surgery, how we are going to prepare the patient. Now, it's not as easy when compared with other one. One is knee means it's we are playing with the bone, so the higher end sterility is indicated. So before the surgery, ideally somebody has to hold the leg of the patient for a long time, and because as you have done the same scrubbing, that much time you also have to do the scrubbing from the entire thigh to this. If it is totally replacement or including foot, you have to wash. Okay, so the entire area you have to wash for 5 to 10 minutes completely with the scrubbing. Same like your surgical scrubbing, you also have to do preliminary. Then only the surgeon will come and do the next thing. So now imagine that we have done the initial type of that scrubbing, and after the scrubbing, now what we do is, so imagine that the scrubbing is over and I just put a sterile gloves and I am giving another person to from the outside to hold the leg as it is. Can someone hold it who is having a glove? Yeah, but yeah, only you are supposed to touch here. Okay, okay, now he is holding it. The next thing is I'm going to do the painting. So I'll take the adequate povidone iodine and just give me a little space. So from the knee, the entire area, I'm using the same gauze only, but you have to change the gauze, and I have to really paint the underneath also, the entire area, and towards this side also. And if you are able, if you wanted to expose this foot also, that also you have to cover separately. Now the next thing is, okay, now the next thing is, the foot is always a dirty area. So one of the best thing to cover the foot is you just wear a glove. Okay, then you're holding it and put the gloves into the patient. Now, since it is a sterile gloves, I can touch it. Now you just drop it as it is. Drop the sterile gloves. No, you drop it, drop it, drop it. Yeah, take it and out. Okay. Now this area is also I have covered. Now I can ask a person who is having a sterile gloves to come and occupy it. So that you can just discard it. No. So you are sterile, right? Your hands was down. Okay. Come and take the foot. Okay. So you can little away you can touch. Okay. Now the thing is, initially I'm just going to put a drape down to the patient bottom. Then only I can move close to it. Okay. Hold it. Take the end. Take the end. Yeah. Take it. Spread it. Spread it. So the thing is, now we both can go close to the patient. Now the next thing which I have to ensure is I have to cover the thigh area. So again, I got an adhesive drape. So what I do is I just keep it on this area, and so for practical purpose, now I am not going to stick it, but ideally you have to remove the sticker, then only you have to put it and just point it to the entire area. Fine. Now the next thing is, you can take now this is the mannequin. The real leg will be really heavy. It's not easy to hold like this for a long time. So if you wanted to put again a leggings, so we can take the leg again. Okay. Yeah. Now take it out. Okay. So now we can unfold it. Okay. Till how much area you wanted to cover, that much area you can unfold it and keep. And we also got, yeah, it's known as clean sheet. You're also sterile, right? Okay, lift it up again. Okay, so if you doesn't want a water entry over there, and you can cover the entire area as much as you want. You can cover it. If you can go for 3-4 round also, that's fine, but now I'm just not going that much. Take it out, and you have a plaster over here which you can stick it. So the water, even though you are going for a knee arthroscopy and all, continuously saline will be flowing, so the entire area will be wet. Okay, now the final draping. So final draping, you have to be careful about this. See, you can see that there is a hole over here, and this particular area is stretchable. Okay, now again, okay. So the first thing which I have to do is, first I have to find out the hole over here, or even though not finding also not a problem. So I'm just inserting it. Yeah, come, hold it. Okay, spread it. Okay, towards that side. Okay, the remaining we will do it later. So spread it toward the entire area. So now it is, if arthroscopy, you may expect lot of fluids. So if you wanted to collect the fluid, what you can do is you can open in this way and keep it. So all the fluid will be collected, and you can see over here there is a suction outlet where you can connect the suction tubing, and whatever fluid is coming, it will be drained to this area. And this is also having a special type contour. So according to the shape, you can adjust it. And now our knee is exposed, we can do the surgery. Suppose if you are doing a knee replacement, if you don't want this, just with a scissor cut this area out. So the remaining area we can use it for surgery. And you can see all these holes over here, especially if it is knee arthroscopy surgery, we have to use lot of tubings. The saline flow has to come, the camera cable, light cable. So all this cable, if you simply hang it, there is a chance that it may fall down. So if you're going all through these holes, then that will be safe. Fine. Now you can keep the leg down. Fine. Thank you. Thank you so much. Actually, I'm supposed to keep it long back, but your hands are again down. It has to be, once you are in a sterile field, hands should be always in your above the umbilicus, not above the chest level, in this direction. Fine. And I will tell you one more thing which we have to always use. Suppose if we both are changing from side to side for some purpose. So how to change is, suppose if we both are, we have to always change in this direction. I should not go in front of him in this way. That is a wrong practice. Or what he has to do is, you also turn to that side, then we can change back to back changing. But it is always identical that, means it is always best that you have to change it in this fashion. Is it clear? Because we are knowing each other, seeing each other without disturbing the sterility field, we are moving it.